Health Informatics by Shah Tarun, Nguyen, Bailey Weiss, and Victoria Farley of Section 10.
What is health informatics? So health informatics is the process of attaining, storing a patient's medical and health history and being able to retrieve it later. In this new era of modern medicine, there's a mixture of old methodologies to new ones to store information. For example, in the old times we use paper to store data, but now with new technologies, we're using computers to store data. But many global networks do not have the computer systems that are capable of different laws regarding information being recorded. So as engineers, we have to develop a trusted system that can deliver information and report files for any emergency and immediate care for any patient worldwide.
Why is better health informatics needed? Health informatics is currently both on paper and in computers, which frustrates many healthcare professionals. Current tools, such as computers, were made to help the field work more efficiently, but still many were unable to give up the traditional paper method. Sharing information about patients worldwide and even countrywide is difficult to do. Many people feel unsafe and unsatisfied with how healthcare works now. Patient care is not working. People are labeled as non-compliant if they are unable to follow an ideal regime. If labeled non-compliant, you're less likely to be treated or seen by doctors.
What are the possible solutions for enhancing health informatics? A possible solution to this array of information would be to engineer a special chip or a sticker that could be plastered upon the person's shoulder. This would allow medical professionals to easily identify any issue of the patient without the need of the patient to physically be in the hospital. Initial testing could be done by using RFID, radio frequency identification tags, that would help in attaining data on how to better implement the solution. The rough estimate to assimilate the entire population of major metropolitan countries would take about 6 months. And how do we ensure that majority of the population would be assimilated into this program is by talking to health insurers of major companies to slowly give these RFID tags to the consumer such that we would gain enough data to further in our program and then slowly enhance the health informatics for the health professional and the patient.
Where do we store such massive amounts of information? We can store this information in a centralized hub or physical data bank. That would contain the information of each patient that would have the RFID microchip, until finally more viable options are made, such as the sticker. Issues regarding that may relate to higher security needs, the more intense cybersecurity and physical security. Political agendas should converge as each country would dictate the need of such data. A large amount of space and energy would be needed by the databank in order to keep the equipment cool and to store the physical data.
Thank you for watching, and if you have any further questions, please ask.